today features an introduction to the Region 4 Mobile Crisis Unit and focusing on that elder crisis response. And we have with us Alexander Schloss, and Alexander is with the Idaho Department of Health and Welfare, Region 4 Mobile Crisis Unit. Alexander is a licensed medical social worker, clinician for the Mobile Crisis Unit, or you may hear it referred to as the MCU. This is a mobile behavioral health response team, again, that is through the Idaho Department of Health and Welfare. Alexander has lived in Idaho for about 7 years and has worked as a therapist and clinician throughout Ada County, Canyon County, and Payette County. So at this time, it's my distinct honor and pleasure to welcome Alexander, or as he has on his screen, Alex, and thank you for sharing your time and your expertise with us.
First of all, thank you for inviting me here today. Morning, everyone. My name is Alexander Schloss. I'm a licensed master social worker. As kind of my introduction started off, initially my work focus was in community behavioral health as a one-to-one individual and family therapist throughout Boise, Caldwell, and Payette. More recently, I transitioned to working as a crisis clinician through the Pathways Community Crisis Center of Southwestern Idaho. And then a little less than a year ago, I started to work for the Mobile Crisis Unit. So what is the Mobile Crisis Unit? Essentially, mobile crisis teams offer community-based intervention to individuals in need wherever they are, including at home, at their work, or anywhere else in the community where the person is experiencing a crisis. The thing that I tell people who reach out to us is that every time you call or interact with the Mobile Crisis Unit, you're getting a trained clinician on the phone to help with navigating a crisis. And as you can see, we both act as both an in-person mobile crisis response team. And so we're active from 8 a.m. to midnight, 7 days a week. But we also provide consultation via phone. It's available all day, every day, including holidays. And so, crisis can take many different forms. It can really appear when you least expect it. And so having a resource that you can reach out to and utilize, I think is of great benefit to our community. So, in terms of goals for mobile crisis, we are guided by the ideology of utilizing or using least restrictive interventions. I think we recognize that when we talk about crisis, there's almost an inherent trauma or potential for trauma to occur. And so by utilizing least restrictive interventions, our goal is to better facilitate a positive experience for the individual and their family, but also positive care. We want, we're definitely doing this for people, by people. And so the goal is to help individuals in crisis to feel relief quickly and to resolve the crisis situation when possible. A big part of that is meeting individuals where they're at, where they're comfortable, where they have the support of family and friends. And then, talking about that least restrictive intervention, we want to provide appropriate care and support while avoiding unnecessary law enforcement involvement, ED use, as in the emergency department, and hospitalization. If we can work with an individual who's experiencing crisis and connect them with resources, and be able to ascertain that they're able to utilize these resources, then we're going to go with that initially. So what can the Mobile Crisis Unit do for you? And this is listed by bullet point, and so I'll kind of explain what this might look like for individuals and their families. The first part is offering referrals and connecting individuals and their families with resources. The behavioral health system is very complex. There's a lot of moving parts, and being able to communicate an understanding of how these parts work and how best to connect individuals with certain resources is what we do. as behavioral health clinicians, we're very familiar with the system. And so if it's a matter of, emailing Optum for additional mental health crisis hours, reaching out to case managers, community-based, support systems or counselors, or, connecting individuals with housing crisis services or communicating with housing managers. This is, that's how we do that. We want to use all the parts of the system to better support individuals. The next part is, something that I think we're all familiar with, which is, educating community members on crisis services and, what DHW, the Department of Health and Welfare, can do for an individual. So, educating community partners about mental illness and de-escalation strategies is that, I think informs how we practice and how we interact with the community. A large part of that is also educating the family about mental illness and the hospitalization process. Not only offering supportive resources to the family, but also to the individual. The big thing that we're a proponent of is definitely that early intervention. And so we don't want a situation to grow beyond, beyond manageable needs. And so we like to encourage family members and community members to request mobile crisis unit services prior to crisis, because if we have this awareness of resources that are really great for early intervention, we want to focus on that before things get to a higher level of care like hospitalization. And then also educate on the services that the Department of Health and Welfare can offer. There are a lot of resources in terms of community support and behavioral health and counseling that are out there. It's just a matter of connecting people to those resources. The other thing that we help with is, helping to formulate safety plans or other diversions. And so, if we are talking to someone on the phone and maybe it doesn't quite meet that level where we need to do a direct intervention, we'll help family and close friends plan for what the future might look like. And so instead of, looking at us coming out, which can, I think be traumatic for someone who might not expect it, there are other diversions and other placements that we can utilize, say like the Pathways Community Crisis Center or Allenbaugh House or any of the other crisis agencies throughout, throughout Ada County or Canyon County. And then the other thing that we also help with is a 7-day follow-up for non-imminent crises. So, you're worried about somebody, you want to make sure that they, and they're willing to engage. We'll call, every day for 7 days just to check in, see if there's any resources that are needed, talk and just make sure everything's going okay. And then if necessary, if it requires a home visit, that's something that we can definitely facilitate. We want people to be aware that the support is there. You don't have to struggle with a lot of these things alone. That there's help. And then the other thing that we do is, we assess on scene for hospitalization or mental health hold need. And so, this is, the 3 main criteria that we are looking for hospitalization as enshrined kind of by the Idaho Code, is SI, HI, and grave disability. SI is suicidal ideation, HI is homicidal ideation, and grave disability is kind of, being unable to take care of yourself as kind of based on a series of criteria that is essentially discussed in the Idaho Code. And then also, we also help with educating on mental health court proceedings. We help with liaising with law enforcement and paramedics for mental holds. And then, that's the big thing. Those are kind of the big things that mobile crisis can do. I was talking a little bit about the Idaho Code. This is what it is: the involuntary hospitalization of the mentally ill. The 3 things that we want to be aware of are danger to self, danger to others, and grave disability as due to a mental illness. That said, there are conditions that are exempted. So epilepsy, developmental disability, physical disability, intellectual disability, chronic alcoholism or drug abuse, or aged unless in addition to mental illness. Mental health hold is, as it is enshrined in the code, is related to a mental health condition. If it's something along the lines of Alzheimer's, dementia, these do not fall under the code for mental holds. And sometimes holds are often improperly placed on these individuals due to a lack of other options. But the reason why this is improper is because treatment utilization for these diagnoses is often very and vastly different than those if it is a result of a mental health condition. The big thing is if you reach out to us, we're probably going to run through a series of questions. Our questions are here to figure out the best way to help and what resources we might need to access in order to help. We're very much like a yes team. We're here to help, and our goal is to help in the best way that we can. I'm looking at my time, and I know I'm running a little short on time. So I'll talk about this. This is the contributing factors of elder crisis. This is just some of the many factors that exist. But in our work with mature adults, these are some of the contributing factors we see that lead to crisis situations. When reaching out to mobile crisis, it might be beneficial. There are individual steps that caregivers and family members can utilize to better support mature adults. These are things to try, which is, and this is very much, it goes back to the discussion of like least restrictive. So what is the least restrictive intervention? So, have you ruled out a medical reason for the concerning behavior? Potentially, is this their first psychotic break? Is there a way to manage risk internally? Does the individual have the ability to do the things they're saying? Do they have a PRN medication, something that can help in the short term? Do they have a family member that can help de-escalate? And above all, what you want to do is make sure to document and be ready to talk about the risk. And so, those things that we mentioned before, kind of the suicidal, the homicidal, the gravely disabled, that's stuff that's definitely important if you're going to be reaching out to us, just so we can provide better care. There are some challenges in terms of elder crisis intervention. It's difficult to navigate the guardianship system. Sometimes there's a lack of crisis resources or placements or housing. And there's really no legal framework for crisis in this population if it's not related to a mental health condition. That said, if you're able to get that information, if you're able to assess kind of as like a boots in the ground, reach out to us. We're here 24/7 to staff these things. We're here to help and to at least provide and refer resources needed. Quick presentation. I apologize, but either the agents, so behavioral health agents are within 4 or within 3, the appropriate numbers. The first one is for the mobile crisis unit in Ada County, Boise, Elmore, and Valley. That's 208-334-0808. And then the second number is for the crisis response team, and that's Owyhee, Canyon, Gem, Payette, Washington, and Adams. Remember, if you know someone is having a crisis, is having suicidal, homicidal thoughts, or you're just worried about their general safety, give us a call. We're here to help, and we want to make sure that everyone gets the